recently, we have, with the development of new antibody-drug conjugates, HER2 directing, it became clinically relevant to detect not only the classic HER2-positive breast cancer, but also those with low levels of HER2 expression, namely HER2-low and HER2-ultralow breast cancer. However, reproducibility and discordance rate amongst pathologists in identifying these cases with low levels of expression is reproducibility is low and disagreement rates are high. So this is really challenging. So in trying to address these gaps, AstraZeneca International, in partnership with Mindpeak from Germany, decided to develop this online training platform integrated with artificial intelligence. And this is a education online platform. And they developed to use in HER2 breast cancer masterclasses. So in these masterclasses, pathologists would evaluate cases, HER2 breast cancer cases in digital slides with AI assistance versus without AI assistance. Each masterclass was divided in three exams A and B, without AI support, and exam C with AI assistance. And with a number of cases in each exam. And also we had some background lectures on HER2. And before exam C with AI assistance, we had a discussion from results from exams A and B. So far we had 13 masterclasses, totalizing 105 pathologists from different countries in South America, Asia, and Africa. And then we had all this data to compare concordance amongst pathologists in recognizing different HER2 scores, IHC scores, and clinical categories with AI assistance versus without AI assistance, and also accuracy, sensitivity, always comparing AI versus without AI. And so far, and also it's important to mention that the gold standard for the IHC HER2 score and HER2 clinical category was a consensus scoring performed by a group of expert pathologists that we called HER2 IHC Center Reference Score. So all the results with AI assistance versus without AI assistance for each pathologist was compared to this center reference score. Our results in almost 2,000 readings from this group of pathologists showed an increase in accuracy and concordance amongst pathologists compared to the center reference score when using AI versus without AI assistance. And we also detected an enhancement in accuracy and concordance for HER2 clinical categories. And then to give you an idea, manual scoring sensitivity was the lowest for HER2-low and HER2-ultralow breast cancer. And then with AI assistance, we detected an increase in sensitivity for detecting HER2-low and HER2-ultralow breast cancer from around 50% to higher than 90%. So higher than 90% to HER2-ultralow, and for HER2-low, 88% of sensitivity compared to around 50% without AI support. So performance was much better when using AI. And this is clinically important because these patients, if we interpreted the tumor as HER2-low, these patients would potentially miss access to highly effective drugs, these new ADCs, HER2-directing ADCs. And we also detected an increase in sensitivity for HER2-low breast cancer from 78% to higher than 90% of sensitivity with AI assistance. HER2-no cases were misinterpreted as HER2-no without AI assistance in 45% of cases, compared to only 11% with AI support. So this is a significant improvement with the use of AI. In summary, our results show that this AI-assisted training platform improve pathologist concordance and sensitivity in detecting HER2-low, HER2-ultralow, and HER2-low breast cancers. And AI reduced misclassification as HER2-no by 24%. Potentially giving more patients access to highly effective therapies. And also we highlight the potential use of AI systems in biomarker training and interpretation. Yeah, so the AI algorithms provide for each case the exact tumor, for each tumor cell, the pattern and intensity of membrane staining. So, and then the AI system colors differently each tumor cell, and each color represents if this tumor cell shows no membrane staining, partial and weak to moderate incomplete membrane staining, complete weak to moderate membrane staining, and complete and intense strong membrane staining for each tumor cell. And then it calculates the total percentage of tumor cells with each pattern of membrane staining, the HER2 IHC final score, and the HER2 clinical category. So we have a complete overview of the tumor, the heterogeneity, and also the final IHC score and clinical categories. So this is really important to have this level of analysis, because then at the same time, for us pathologists, during manual scoring, we use our eyes. So for us, it's virtually impossible to count every and each tumor cell. And for HER2-no versus HER2-ultralow, the difference is really subtle. And that's why the sensitivity improved so much with AI assistance, because sometimes the staining is really weak and really focal, and we have trouble calculating the exact percentage. We have cases that are borderline between HER2-ultralow and HER2-low. So this is all taken into account in the AI analysis. And also for validation, we had a large number of cases, HER2 breast cancer cases, and the validation set was enriched for cases with low levels of expression. This is really important during the machine learning process. And the AI algorithm has to be specific for HER2-low and HER2-ultralow breast cancer. You cannot use an algorithm that is for HER2 in general, because during the validation set and the machine learning process, you would have more cases, HER2-positive cases, and then the algorithm wouldn't be trained appropriately to detect HER2-low and HER2-ultralow breast cancer cases.